Trends, Friends, and Fatal Ends was created to raise awareness of potential hazards facing the youth in our community. This program includes images of a graphic nature which may not be suitable for younger viewers. Viewer discretion is advised.
Hello, and welcome to Insights with Dr. C. My name is Dr. Douglas Carpenter. I and my wife, Mary Carpenter, are the owners of Insight Counseling Services. Today, we're bringing you part 4 of a series that we've been discussing. Its title is Friends, Trends, and Fatal Ends. So we're going to look at trends in youth and risky behavior, friends, how they join in, and potential fatal risk that your child can be involved in. At the beginning of the show, you heard a disclaimer. The disclaimer was to not do any of the things that were listed on the show today and that we're going to be talking about, but also to caution your children and if you're going to allow them to view this. I would caution you to not allow your children or your teens to view this show as it runs, but if you do choose to do that, make sure that you have an open dialogue with them. Today we're discussing many of the dangers. I want you to see how serious some of the things that I'm going to be presenting are. So let's get started. So the first thing we're going to talk about today is something called izzurp or lean. It can go by a couple of different names on the street. There are drug dealers that sell this. It's also possible for you to make it on your own. The active ingredient is a medication called promethazine, which is an antihistamine. Now, if you've been to your local Walmart or Meijer's or some drugstore and you've needed to buy an antihistamine, you'll probably notice that they're now behind the counter and that you need to go ask to purchase these items. And the reason for that is because it's an active ingredient in many of the drugs that are being made by people at home or on the streets right now. So promethazine, as I said, is an antihistamine, and there are many different ingredients that can be included in this. So this is similar to like Four Loko, some of the things that we talked about in the prior shows, and drinking this and the high that you get and the feelings that you get are positive, but can also be damaging because you're overdosing basically on a medicine that's not designed to be used in that quantity or in that volume. All right, the next area that we're going to talk about is marijuana. Naturally, this is a big topic, especially in Michigan right now, because of medical marijuana. We're one of the states that allow medical marijuana, and some of the problems with medical marijuana is how it's governed at this point and in our state. But I wanted to point out that the youth of today don't see marijuana as a problem. They see it more as a natural occurring plant. What's wrong with it? Alcohol is worse. Alcohol impairs you more. I wish I had a dime for every time I've heard this inside my office, that, oh, it's natural. I don't need to worry about it. I can use it. It's no big deal. Well, there are problems with this. Marijuana use has increased in our state with the passing of medical marijuana. And we'll talk more about that in a couple of minutes. But also what's very important to point out is the marijuana that's being sold today in dispensaries, on the street to people, it's about 10 times stronger than the marijuana that was being sold in the 60s and 70s. And that's because of all the hybrids, how they've chosen to grow it and cross plants. And so the THC, which is the active ingredient in marijuana, is much stronger than it once was in the 60s and 70s. Because the THC is stronger in the current marijuana being sold, we are actually now seeing physiological signs of withdrawal when someone begins to back away or discontinue their use of marijuana. It used to be in the past that people would say that marijuana was not physiologically or physically dependent. Unfortunately, that is not the case anymore. We've also seen many studies that show that when a person begins to use marijuana and they use it on a long-term basis and then they discontinue it, there can be an ongoing, lasting depression that's medication resistant. So antidepressants have a very difficult time counteracting the depression that's left from chronic marijuana use. More than likely, it's due to the disruption of the receptors in the brain with various neurotransmitters such as serotonin and dopamine receptors. So the strength of this is very problematic with people using it on a regular basis. There is also a set of research that shows that many people are struggling with chronic anxiety. Sometimes, even after their first use, they can begin to have panic attacks. Some people will say, I've never ever had a problem with anxiety. And they will begin using marijuana on a consistent, regular basis and then develop problems with anxiety or panic attacks. Now, one of the medical marijuana uses for marijuana is for anxiety in very small amounts. It can decrease anxiety. So I'm not saying that it's all bad. And if you're someone who legitimately needs it and you have a legitimate doctor, that's between you and your doctor. However, chronic use is the problem that we're talking about today. Also, there's a body of research from the British Journal of Medicine that shows a correlation between long-term marijuana use and the development of psychotic symptoms that you would typically see in schizophrenia. That the longer the person is on marijuana, they have a 50% greater chance later on, like within 10 years, of developing schizophrenic type symptoms. So the strength and the THC that's in the current medical or in the marijuana that's being sold is problematic. So don't kid yourself. There are numerous studies showing some of the adverse effects of marijuana. In fact, another study showed that chronic pot smokers in males are at a 70% higher risk of testicular cancer. So there are many ramifications of ongoing long-term pot use. All right, just in our state, when we look at medical marijuana, the average person in the state of Michigan with a medical marijuana card is a Caucasian, 32-year-old male with no real medical illness and has a positive history of drugs and alcohol. Naturally, that's a problem as well, that these individuals are able to go to doctors, say, I have this illness or this hurts or I have this ache or pain, and then they're being given the paperwork to fill out for receiving medical marijuana, then it's being processed, the doctor signs off for it, and then they end up with a medical marijuana card. Medical marijuana is helpful for certain things like glaucoma, seizure disorders. There are documented illnesses that medical marijuana can be helpful for. Unfortunately, we have many people going to doctors feigning illnesses, or we have doctors out there who are willing to give you the paperwork if it's something that you're interested in because maybe the doctor believes that marijuana should be legalized. So this is a problem. Also, the youngest person in our state with a medical marijuana card is approximately 4 years old. I'm sure that person probably has some kind of disorder that might allow for that or account for that. However, it's a broad range of people who are receiving medical marijuana in our state. I used to be the president of the Troy Community Coalition, which is an excellent community resource that educates the public about drugs and alcohol, and especially youth and adolescents. And so we stay very much ahead of and on top of the statistics that are out. And I would encourage you to support the Troy Community Coalition in their efforts to educate the public. Now, you may have heard some of these terms on TV or on the internet or from your children. You may have heard this called butter. It's B-U-D-D-E-R, or wax, or dabs. And what this is basically a concentrated, cooked down form of marijuana. So they take large quantities of marijuana. There are specific ways to cook it down. And when you cook it down with a few other ingredients, it melts down into this very sticky brown substance that as it coagulates and solidifies, almost kind of looks like putty or gummy paste. And then they can roll it out, package it into little bite size, and then package it like into candies or dabs or other ways that I'll get ready to show you here. You can also take this dab and put it in like an e-cigarette or a vaporizer of some sort. And then once you light it, start cooking it, then it turns into an oil, and then you can vaporize it. So the problem with the dabs or the wax is also that there's such a high form of THC. It's such a high concentrate in THC that the person may not be fully aware of how much THC they're getting in their system as they use the dab or the wax or the butter or however it comes along. All right, here's something fairly new. These are patches, much like pain patches that you would get from a doctor if you have a chronic pain situation where the patch goes on your skin, or like the nicotine patch where the medicine is released slowly into your skin and then into your muscles for absorption. These are marijuana patches that can be worn for the same effect. So these are things you want to watch out for. Look for if you see these kinds of packaging in your teen's room. These are called medibles. They are mainly coming out of the state of Colorado, which we've all heard on the news is really into dispensaries and the legalization of marijuana and medical marijuana. So this is ice cream. This is a company that makes ice cream. I can't exactly remember the name of the ice cream off the top of my head, but they have over 50 different flavors where marijuana is infused into the ice cream. There's all kinds of different edibles here. There are elixirs which have marijuana mixed into the soda-like fruity flavored drinks. Chiba Chews, these are types of candy. If you look here, you'll see many different, what seems to be familiar packaging of candy bars, but they've had to change the names and variations a little bit so they're not breaking copyright laws. But like this looks like a York peppermint patty or a Crunch bar or Butterfinger. So some of these are very recognizable Reese's. And these are, again, candy bars with marijuana infused in them. Similar to Pop-Tarts, but they call them Pot Tarts. Here are lollipop suckers that have marijuana infused. Now, one of the problems with these, and a lot of these were developed for cancer patients or people who were needing medical marijuana that did not want to smoke it or vaporize it. They've put it in these foods to mask the flavor. However, some kids will get a hold of these things and may not know what they are, so they may not realize that they're getting marijuana, or like drinking the elixirs, because they're fruity, they may taste good. The person may be ingesting and drinking more than what they think they're ingesting, or taking more marijuana in because it's in a nice flavorful substance than they actually wanted to take in. And that can lead to medical emergencies. This is a lot like boozed gummy bears. This is, you can basically take the THC oil and you can put it in all kinds of candies and mixes and cook it in things that parents, you would never be aware that your child has done this. So when your child has friends over, if you see odd behaviors, question that. Be an active part of their lives and what's going on, and make sure you check in with the group of kids that are there at your house and see how they're acting and what they're doing, because this could easily get by you and you would have no idea what was occurring. Now, this is a big area of concern. This is marijuana synthetics. So these go by a few other names you might have heard. K2, Spice are some of the very popular ones, and they're advertised as incense. Okay, so not for human consumption, but they are. People are using them and smoking them as if it was marijuana. The way these are made is in China. Typically, most of them come out of China. They use some kind of substance like tree bark or like a potpourri type substance. It's on a big conveyor belt. It goes through the conveyor belt. As it's passing through, there are machines that spray chemicals down onto the bark. It's then ground up, packaged, and then sold, and a lot of it's brought to the United States. And then at one point, these were sold in many gas stations around the area. A couple years ago, Michigan outlawed synthetic marijuana. The Troy Community Coalition that I mentioned earlier was an active part of fighting against that and getting it illegalized. in our state, and we're very happy that it did. Now, some of the problems with illegalizing this is the substances that are used. You have to illegalize every chemical that's used, or some states have went now to making kind of some blanket laws against some of these products, which is definitely a step in the right direction. These are extremely dangerous. People can die from their very first use. They can have extreme medical emergencies. Your kidneys can shut down. Your heart can fail. Serious medical concerns. It can make you want to do crazy things that you just would not have normally done, or even done if you were just high on marijuana or some other drugs, because these are chemicals that are not made for ingestion. So let me go back for just 1 second. As I mentioned, synthetic marijuanas have been illegalized, especially in our state. So these are kind of more underground. You have to find someone to buy them from at this point. However, there's an emergence of another type of synthetic drug that is problematic, that needs to be outlawed, and that is synthetic hallucinogens. And there are endless combinations to making synthetic hallucinogens. It can go by a couple of different names. The street name is typically Smiles, but it can also go by 2C1, 2CP. There are multiple combinations of this, and it often looks like this type of substance, almost like a popcorn type substance. So these are synthetic hallucinogens. So they're short-acting synthetic psychedelics. These started in Europe in about 2003. There have been numerous overdoses. Here's some of the chemical compounds amongst hundreds that can be used to make these products. The effects can last up to 8 hours, so it's very dangerous. It's often like a combination too, along with psychedelics, of hallucinogens and amphetamines. So here you're having extreme amounts of energy and a hallucinatory experience at the same time, which causes a lot of danger for people experiencing it. It can come in tablets, powders. You can melt it down. You can soak it in thin papers and make it on blotter paper. You can smoke it with marijuana. So this comes in multiple forms, and it's very dangerous. In fact, this is an actor his name was Johnny Lewis. He was from the Sons of Anarchy on TV. He was believed to have taken 2C1 or Smiles, and then had a psychotic episode where he killed his 81-year landlord and then eventually killed himself. So these drugs will make you do things that you aren't aware that you're doing. It's also like a form of bath salt. These cause psychotic-like symptoms, delusions, paranoia, and typically self-harm. So naturally, these packages say that they're not for human consumption, but then people do use them. So bath salts can lead to, here's some of the medical problems: increased blood pressure and heart rate. So you can have heart medical emergencies, neurological problems such as seizures. Some of these medications have caused seizures to the point that in ERs, the doctors have given the patient everything they could possibly do to stop seizures, and the seizures have not abated. The other problem is when you take one of these and you come into an ER with a medical emergency, we don't actually know what you've taken in this or the active ingredients, and so the doctors, nurses don't know how to counteract it, because what if that interacts or has what's called a synergistic effect with the chemical that you have ingested? They can then cause a further medical emergency. So this is extremely dangerous. You can have kidney damage or failure and even death. From a psychiatric standpoint, bath salts can lead to severe psychosis marked by pronounced paranoia, so a very strong unrealistic fear, and hallucinations. Extreme depression, suicidal thoughts are common, agitation, and aggressive behavior. There have also been multiple ambulance runs, police runs, situations in the ER where people have come in having taken bath salts, and their strength is so catastrophic and so strong that it takes multiple people to get them restrained and then strap them down, because they're extremely aggressive and extremely violent. Now here's something kind of new. It's called Pump It Up powder or Pump It powder. Geranamine is the active ingredient in this. It's somewhat replacing bath salts right now. It's an enhanced plant vitamin, amphetamine-related stimulant, and a decongestant found in the geranium plant. One problem with some of these synthetic drugs, especially bath salts, is that it makes you have a desire to want to carve on your skin, which can be very, very dangerous. As you can see here, some of these individuals have already done that, have carved on their skin and hurt themselves significantly. One of the other big things that are happening right now are called drug cooks. These are people who are ordering these chemicals that are made in these products online, and then they're creating products themselves. This individual actually created a substance in Grand Forks, and a couple of teens died from the ingredients that he threw together and then sold them as a product or a drug to get high with. Nitrous oxide is something else that is kind of being used right now. This has been around for a while. It can be called whippets. There are products that you can buy in kits to help you use nitro, whipped cream cans, spray cans. Some of the things that are pressurized here can be used to extract the nitrous oxide and get high with. So if you see these things in your kids' rooms or just weird looking cans that shouldn't be there, make sure you look into that. Along those lines, similar is another kind of nitrous called poppers. This is typically used to enhance sexual pleasure, and there are numerous products out there, and these can be dangerous. So poppers, what happens when you take a popper? It actually causes a relaxation of involuntary smooth or soft muscle tissue, and these can be found in various parts of your body. They're also very vasodilators, which opens up blood flow throughout the body and the brain. So you can have different effects throughout your body from having an increase in blood flow. The increased sensitivity to touch and other physical sensations is what makes this popular. A feeling of pleasant warmth throughout the body, and a feeling of a head rush and lightheadedness as a larger than usual amount of oxygen-bearing blood enters the brain. So these can be very problematic. And like I said in a previous show, anytime that you're inhaling a substance, it passes your blood-brain barrier. This is extremely dangerous because the product, the substance that you're ingesting or inhaling, goes right to your brain and can cause permanent damage. A lot of times, damage that's done neurologically with inhalants is not something that you're going to regain back. The neurogenesis, it can't regenerate the nerve cells that are lost, so it leads to permanent damage. Now, overdosing on supplements. As you can see, this is a very young boy, probably 14, 15, maybe 16, and look at the muscles that he has. This is abnormal for a child his age. Now, recent research and studies have shown that these are protein enhancements, so lots of people are taking these who work out. They're kind of all over. But this is problematic too because they can be harmful to the natural growth process. So as a young person's body is changing, they're going through puberty, there's brain development and growth. A person's brain is actually not completely developed until they're 25 years of age. Your brain goes through a process, what's called myelination. Myelination is where it's a sheath that covers the gray matter and the various types of matter in your brain, and it helps connect synapses and helps the electrical currents to flow and the speed of those. Your brain is not completely myelinated and developed until age 25. When you start taking substances like this, it interferes with your brain's ability to develop accurately and myelinate the way that it's supposed to. So taking substances that your body's not prepared for or are foreign substances that you shouldn't have in your body can interrupt with brain development. And so this is what we're seeing here with the overdosing on supplements, that some of these kids are taking these before their brains and their bodies are developed and prepared for this. And we see that it's interfering with the development of adolescence. Now, another research study showed that these are typically naturally abused among young athletes, and that 40% of young athletes were encouraged and taking some kind of supplement to enhance their performance, enhance their strength and their ability to build muscle. Now, these are legal products. You can buy them, in many stores. You can walk in a department store or a drugstore or GNC or a store, something similar to that, and buy some of these products. They're legal. Now, there are other substances, which I'm sure you've heard of, like anabolic steroids that you can buy off the internet that can do this same thing, and maybe even faster, but there are significant physical problems related to anabolic steroid use. Now, this is our last slide for this presentation, but I want you to be consciously aware of something called caffeine powder, which we all know what caffeine is. We all go to Starbucks. We all need our caffeine in the morning, okay? But the amount of caffeine that you get in a cup of coffee is maybe around 95 milligrams. So 1 cup of 8-ounce black coffee has about 95 milligrams. So the old product here, No Dose, to help you stay awake when you're driving or falling asleep, has about 200 milligrams. Our bodies really shouldn't have, if I remember correctly, more than about 400 or 420 milligrams of caffeine a day. That would be like the limit. That would be a high volume of caffeine. Now, when you take caffeine powder and you take it in a spoon like this, it's possible that you're getting up to 3,200 milligrams per teaspoon. This young man died from taking an overdose of caffeine powder. Now, when a young person is offered a spoonful of caffeine powder, they have no idea how many milligrams are in that spoon of powder. I'm sure he wasn't thinking, I'm taking a lethal dose of caffeine, but he did. So be very careful if someone offers, or you have caffeine powder, or you've found out that your kids have ordered it. So parents, in wrapping up today, I really want to encourage you to not be afraid to go in your teen's room. Make sure that you go in, that you search through things, that you look at things. That's your property. Be a responsible parent. If you see things in your kid's bedroom that are strange, that are odd, that shouldn't be in there, be curious. Be a detective. Search those things out, because there are so many this is such a broad topic, and I'm just presenting a few things to you today, but it's such a broad topic. Make sure that you are being the most cautious and appropriate parent that you can be. So we really thank you for listening today. I hope that you've learned some important information, and until next time, live well.